The Executive Director of Paradigm for Social Justice and Development, Asanda Zura, says that young people are increasingly taking an active role in shaping sexual and reproductive health services and decisions affecting their lives. Zura says that this follows a youth-focused sexual and reproductive health and rights program implemented by PSD and its civil society partners in Wakiso, Kampala and refugee communities.
The program strengthened 20 public health facilities and trained more than 150 health workers to provide respectful, adolescent-responsive care.
We've created platforms where young people are now free to interact with policymakers as well as be able to raise issues that affect young people. We've also seen an increase in terms of uptake of services, SRHR services from different facilities as a result of the program. We have also been able to create a platform where partners within Uganda are able to interact with different partners across different countries such as Zambia, Malawi, Kenya, as well as Zimbabwe.
It also revived youth-friendly spaces and referral pathways while training young people as peer educators, health champions and advocates.
A health corner had been closed, so they were able to approach the officer in charge. They lobbied and that corner is now functional. They have a day where they go, they receive information, they get services, and that has been very, very key to ensure that they get the accurate services, the accurate information, as well as make informed decisions.
More than 3,000 adolescents received sexual and reproductive health information and services, while 1,912 girls and young women were reached through PSD interventions.
So here we had 20 public health facilities that were strengthened with over 150 health workers that were trained. We also reactivated some of the referral pathways that had been dormant, and then also strengthened the referral and the peer-led access, where we saw young people coming up to be mentored as peers so that they can roll out and reach their fellow young people.
Young people are also participating in the District Committee on Adolescent Health.
But also we've been able to engage our young people with disability on different platforms. For example, some of them have been on podcasts, they've also been on meetings, there have been panelists in different areas. We've empowered them to not look at their disability as something that does not enable them to do something, but use that disability to empower them, engage and be at different levels of programming.
Youth uptake of sexual and reproductive health services increased from 35% in 2024 to 65% in 2025.
So we had 120 girls and young women trained as advocates, and these advocates went on to roll out to reach other young people, and they formed groups or clubs where they were able to share information among themselves. We also had Wakiso, at the DAICA, the District Committee on Adolescent Health. We had young people participating into this forum, and they were able to bring out critical things that were affecting them.
Paradigm for Social Development says the program aims to move young people from being beneficiaries to becoming advocates, leaders and active participants in decisions affecting their health and well-being. For UBC News, I am Sudat Kaye.